Right, let's take a closer look at COVID-19 with one 24-hour period showing over 4,500 new infections across South Africa. That is getting us very, very close to that borderline for a third wave across the country. I'm joined now from the Western Cape by Western Cape Head of Health, Dr. Keith Cloete. Doctor, thank you so much for your time. Just referencing that package we've just listened to from Heidi Jokos, concerns about the EVDS system. How's it going in the Western Cape? Are you happy with the way the system is working?
Good evening, Sally, and good evening to the viewers. Like everybody else, we are experiencing our challenges with the system. The system is designed to be able to assign appointments to people based on when they registered. So everybody after the 16th of April should get their appointments first. But then the system also seeks the place closest to where the person lives, and then assign them accordingly in terms of available appointment slots at those places. So we've had quite a few people receiving the SMSs, but as sites come online and more appointment slots become available, more and more SMSs are released. But we've had our glitches because not many sites were online, so people then get sites assigned to them quite far from where they live. But we believe that if we bring more sites online and more slots online, the system will stabilize from where we sit.
We know that we're on about 50,000 vaccinations a day nationally, and we're hoping to see those numbers increase. How's it going in the Western Cape in terms of doing more and more vaccinations every day? Are you achieving that?
Yes, Sally. Last week we did just over 10,000 vaccinations in the first week as we were getting our systems ready. That was about 2,000 a day. We're up to yesterday now, we're up to 8,000 vaccines a day, and we target to do more than 30,000 for this week. Our target for next week is to exceed 60,000, so that means we want to be more than 12,000 vaccines a day next week in this province, and the week after we are targeting to get up to about 24,000 doses a day. That makes it about 120,000 doses next week.
All right, so ramping up quite quickly. Your position on walk-ins, helpful or harmful?
I think sanity has prevailed in that at the beginning stages of where we are, you probably need a dual system. And so what we've articulated today very clearly to the media is that we're formally endorsing a dual system. And what we mean by a dual system is, as the appointment system finds its feet and comes right, the more and more people will actually come to the sites with appointments. So at this point in time, we are saying that we give preference to people with appointments. So we have two lines. One is, if you've got an appointment, you arrive, you are helped basically within 45 minutes, and you get prioritized. If you do not have an appointment, we have some capacity for walk-ins, but obviously it is on the basis that you will wait, and only if there's sufficient capacity at the site will you then be processed. So with that system, we cannot guarantee how fast you will be helped, but if there's capacity, you will be helped. So we believe, Sally, that you have a dual system to go get us over the next 2 weeks, and as more and more sites come online, more appointments slots are open, and more SMSs go out, more and more people will come with appointments. So the queue in appointments will grow, and hopefully the queue for walk-ins will get less.
All right. Okay, that sounds like a good system indeed. We have just seen over 4,500 new infections in one day nationally in the last 24-hour reporting cycle, very close to that 5,000 mark, which suggests we will then be fully in a third wave. The positivity rate of tests, 10% of all tests done are now showing positive. That is double the 5%, which is seen as a sort of safe amount of positivity. How concerned are you about new infections in the Western Cape, and how full are your hospitals getting?
Okay, so Sally, we are still what we call officially in the resurgence. We have gone up to about 218 new cases a day. So we're still far off of the third wave. Our test positivity is just over 6%, so we're still well below the 10%. Our hospitalizations is about 35 to 40 admissions a day, and our death is about 4 a day. So we have a resurgence, and we're starting to see increased cases, but not quite at the rapid rate as is seen in other provinces. We have a very vigilant system. We have introduced today and also made public that we have now got a very clear trigger system. It's almost like a 4-layered warning system. We are now in that first layer because we only have some cases for a period of time, and we now on heightened behavior for everyone to contain the spread. There's a second layer, then we will trigger some additional hospital capacity, etc. But at this point in time, our hospital admissions is not that much. It's about 6% of all hospitalization is currently COVID cases. And that's where we are. Yeah.
Would you think that nationally we need to start looking at restrictions? We know that there's a chance the President is going to address the nation soon.
So in the trigger system that I'm talking about, Sally, we very much say that there are certain things that you need to do while you are increasing cases. And things like gatherings, adhering to the level 1 restrictions, mask wearing, and then maybe travel into areas of high risk would be things that we need to be concerned about. My sense is when the country enters a third wave, because we're very much aware of what's happening in Gauteng, Northwest, Free State, and Northern Cape. One of our concerns is the West Coast, and we're watching it very clearly with the N7 of cases coming from Northern Cape, is a concern to us because there's some increases in Vredendal along the N7. So my sense is that when when the President and the PCC is meeting, we are putting recommendations forward to our Premier. Our Premier will be participating in what's called the PCC meeting on Saturday, when the President calls all the Premiers together, and there will be discussions of what are the options, and potentially there would be some restrictions, but at this point in time we're not quite clear on what it would be. The Western Cape has clear recommendations of a very systematic way of doing that.
All right, well, thank you so much for that update. That was Dr. Keith Cloete, the Western Cape's Head of Health.